Hi everybody, here is your training on punishment and crisis management. So for this video, we are first going to talk about, we're just going to briefly review the definition of punishment. Then we're going to talk about punishment procedures, so negative punishment procedures and positive punishment procedures. We're going to talk about how punishment relates to extinction. And then we're going to go into some crisis management and wrap it up with the cycle of acting out. And then we'll do our summary. So here are our objectives, and if you guys are following along with me with regards to the task list, you guys can mark off D6 for this training video. Okay, so let's look at punishment first. So just to briefly go over the definition of punishment, maybe remember the definition of punishment is that there's a stimulus change that's contingent on a response that decreases the future probability of the response. And remember, we have both positive punishment and negative punishment. So with positive punishment, a response occurs and a stimulus is presented. That's where we get the positive. And with punishment, it's typically an aversive stimulus, and therefore the future probability of the behavior is going to decrease. Remember that we're always looking at the effects on behavior. So if the response doesn't decrease, then it's not punishment. And also, when we talk about a stimulus being aversive, we're talking about a stimulus that decreases behavior. And that's what we mean by aversive. We don't necessarily mean that it's a stimulus that is harmful to the person, but just that it's aversive and it's going to decrease behavior. With negative punishment, you have something pleasant that's in effect. A response occurs, and that pleasant stimulus is removed, and therefore the future probability of the response is going to decrease. An example of negative punishment is if you guys, maybe you, I don't know, talk back to your parents, and so they take your phone away, and therefore you don't talk back to your parents anymore. So that would be an example of negative punishment. The behavior, you have your phone, it's in effect, you're using it, the response occurs, you talk back to your parents, they remove your phone, and therefore your behavior of talking back to your parents decreases. So remember, there's a response that occurs, and for it to be punishment, the future probability of that response is going to decrease. So steps to remember, this is similar, very similar to our steps to remember with regards to reinforcement, and we talked about this in our basic concepts course, our basic concepts training unit towards the beginning of the semester. But first you want to figure out what's the behavior that you want to change, and then what's the desired change as a result of the consequences. So look at the behavior, you present, the person engages in the behavior, you get a consequence, and what happens to the behavior. Remember, it's all about the effects on behavior. If the behavior increases, it's reinforcement. If it decreases, it's punishment. And then you want to look at the nature of the consequence. So after the child or the learner engages in the behavior, does something get added or removed? If something gets applied or added, it's positive punishment. And remember, with punishment, you're adding an aversive stimulus, or is something getting removed, and that would be negative punishment, in which you're taking away a positive stimulus. With punishment, a couple of things to keep in mind. First thing is that, remember, with behavior analysis, we have a lot of technical definitions. We have technical definitions of reinforcement, we have technical definitions of extinction, of punishment, of stimulus control, and everything like that. And with punishment, our technical definition is simply a procedure that is going to decrease the future probability of behavior. However, if you use punishment in the everyday world, people it has this negative connotation. And so this lay definition of punishment typically means that you are harming the person, you're causing them pain and things like that. So be really careful. Remember, we talked about with our ethics code that you guys have an ethical obligation to explain our procedures to people that are not behavior analysts, such as teachers and parents and the general public. And you have an obligation to explain our procedures in non-technical language. And so this is one of these things where you may not even want to use the term punishment in front of parents because it does have a really bad connotation. A lot of times parents just shut down. So really trying to, talk about punishment in a way, it's very technical for us, but trying to explain that to parents is key, because you want to explain to them that you're not hurting them. You're basically implementing a procedure that's going to decrease a challenging behavior. And so really looking at the word punishment and the negative connotation that it is, you have to figure out, how am I going to explain this to parents in a way that they understand and they don't think that I'm harming their kid? Because the minute you throw the word punishment out, they might shut down. Realize that the definition of aversive doesn't equal painful. So we talked about this in the last slide, or the last two slides. With positive punishment, they engage in the response, and then the stimulus change is an aversive stimulus gets presented. Remember, aversive means the effects on behavior. So aversive means that the future, after the person receives the aversive stimulus, the behavior is going to decrease in the future. So that's what we mean by aversive. It's a functional definition. It's not aversive meaning painful. With punishment, with our technical definition of punishment, we actually see that punishment occurs all the time as a result of our interactions with the natural environment. We learn to engage in behaviors in certain contexts and not in other contexts. For example, you guys go in the library, and probably in the past you've talked loud and the librarian has probably reprimanded you. So now in the future, your behavior of talking loud in the library has decreased. You don't talk loud, you talk really softly. And according to behavior analysis, our technical definition, that would be positive punishment. So we, in our interactions with the environment, when we learn to engage in behaviors and not in others, not engaged with other behaviors, then that's just coming into contact with punishment contingencies. However, if you're going to deliberately program it into treatment, then it becomes a little different because of that lay definition and the negative connotation of punishment and the misconceptions of it. So if you are going to deliberately program it into your treatment, then you need to make sure that you've fully explained it to the parents. They know what you're doing, they know the procedure, and they are on board, or you've explained it to your IEP team and things like that. So everybody needs to be on board. The parents need to provide consent and everything like that. Okay, I have this video for you guys in your module, and I really like it. It talks about kind of what I touched on in the last slide about just the lay definition of punishment and our technical definition, and how we, come into contact with punishment contingencies all the time. But if you say the word punishment to parents, a lot of times they shut down. So I think he does a really good job of explaining that. So I want you guys to watch that. Oh.
It's worth seeing.
Okay. So let's get into some punishment procedures. I'm first going to talk about negative punishment procedures. Remember, with negative punishment, something pleasant is in effect. The kid engages in a behavior and that pleasant stimulus gets removed, and therefore the future probability of the behavior is going to decrease. One negative punishment procedure is what we call timeout. So timeout is being removed from a reinforcing environment for a short period of time. You can have different types of timeout. You can have exclusionary and non-exclusionary. Exclusionary typically means that the kid is taken to a different room, but it doesn't necessarily mean a different room. So sometimes it's classified, if you take the kid and you put them in the corner and they're facing the corner, that's also sometimes classified as exclusionary. Non-exclusionary is where they typically are removed from the activity, but they might stay in the same room, or they might be actually able to watch the activity. So that's the difference between exclusionary and non-exclusionary. Remember, timeout needs to be brief. So a lot of times parents use timeout with their kids, but they send them to their room, and their kids will be in their room for 15, 30 minutes, an hour. That's not how you effectively use timeout. Timeout should be brief. It should typically be between, I think, 2 and 5 minutes. So really briefly. And if at the end of that 3 minutes or however long the learner is in timeout, if the problem behavior is occurring, then you want to extend the time, and you're not going to give them another 3 minutes. You might cut it in half or something like that, or give them another 30 seconds. You just don't want to get them out of timeout if they're engaging in the challenging behavior. So, if your timeout period is 2 minutes, 2 minutes the timer goes off. You always typically want to have timers for timeout as well. Like we talked about with our antecedent procedures, timers make things non-arbitrary, and it's very clear-cut how long the kid needs to stay in timeout. He knows you're not putting him in there for longer, anything like that. So you have your 2 minutes, you set your timer, 2-minute timer goes off. If the kid's engaging in problem behavior or challenging behavior, then you might want to extend it another 30 seconds. So you don't do a whole another 2 minutes, just extend it a little bit longer. Timeout must occur immediately following the behavior. So typically with timeouts, once the kid engages in the behavior, you remove them and they go to timeout. So they learn this contingency between I engaged in this behavior and this is what happens. You don't need to, if you wait to put them in timeout, you may be actually decreasing a behavior. You'll give them time to engage in other behaviors, and you might actually be decreasing a behavior that was not the behavior that you intended to decrease. So they engage in the challenging behavior, and immediately they go to timeouts. You want to make sure that your timeout environment is safe. So whatever environment you remove them to, a separate part of the room, a different room, just make sure that it's safe and they're safe in the timeout environment. And the key thing with timeout is that the environment that you remove the person from must be reinforcing. So they must want to be in that environment, and therefore when you remove them from it, that's why it's going to decrease the challenging behavior, because they don't want to be removed from that environment. So you always want to make sure that the environment you're removing them from is way more reinforcing than the timeout environment. This is also another mistake that parents oftentimes make. They're at dinner and they say, okay, you're not going to finish your vegetables, go to your room. And so the kid goes to his room, and it's a great situation for the kid. Finishing his vegetables is not a reinforcing situation for them. They don't want to be there, and their room has all these toys and it's fun. So they're completely okay with going to their room. So for that situation, that timeout would not be appropriate. You have to make sure that that environment that you remove them from, they want to be in that environment. It's super reinforcing. All right, with timeout, you want to make sure that it's practical. So, if the kid refuses to go to timeout, are you going to be able to guide them to timeout? If you have a kid that's bigger or could cause harm to you and things like that, timeout might not be practical, especially if they refuse. You always want to use timeout together with reinforcement. So the kid engages in a challenging behavior. Say you're doing group time or they're playing and the kid hits another peer. And so you immediately take them and you put them in timeout. You want to make sure that when you bring them back to the actual situation and they behave appropriately, you reinforce that behavior. Don't just think to yourself, okay, now they're responding appropriately or now they're behaving appropriately. You see that, you reinforce it. Remember, for a behavior to increase, you need to reinforce it. You want to avoid interactions during timeout. So you really don't need to say anything to the kid. The kid engages in the problem behavior, they get removed from the situation, and they will learn that contingency. You really don't want to explain it, nothing like that, especially on the way to timeout. You want to avoid any type of interaction, especially if they're engaging in the challenging behavior for attention. So they engage in the challenging behavior, you don't need to say anything, the least amount of attention as possible. You just take them and they go to timeout. After timeout, if you want to explain what happened, things like that, then of course you're more than welcome to. But before the timeout, you don't need to do that. You don't need to give them any type of attention. Avoid those interactions. Right when they engage in the behavior, they go to timeout, and they will very quickly learn that contingency. And finally, you do not want to use timeout for escape maintain behavior or behavior maintained by sensory stimulation. And the reason for that is that if they are engaging in the challenging behavior to escape the situation, then timeout is actually reinforcing their behavior. And so I really like this meme. It says, you have him sit in a chair in the corner and call it timeout, but the function of the behavior is escape. So this goes back to, once again, knowing the function of the behavior. If the function of behavior is attention or tangibles, then timeout is a really effective procedure because they want to be in that environment where they get the attention and they get those tangibles. But if the function of the problem behavior is escape and they don't want to be in that environment, then you putting them in a timeout is actually reinforcing that behavior because you're allowing them to escape. And then behavior maintained by sensory stimulation. Remember, that behavior is maintained by automatic reinforcement. So the behavior within itself is reinforcing. And so they're not engaging the behavior because they want attention or want a tangible or want something from that activity or that environment. And so you taking them out of the environment and putting them in timeout, they're going to engage in the behavior in timeout just as much as they would be in the actual environment. So if your function of problem behavior is attention or tangible, then timeout, effective procedure. If it's escape or sensory, not the procedure that you want to use. Okay, a second negative punishment procedure is what we call a response cost. So this is when you remove a reinforcer contingent on a response. So basically the behavior costs something. We have response costs all the time in the natural world. I don't know if you guys have ever gotten a ticket. If you got a ticket, that's an example of a response cost. So you have money in your pocket, money in your bank account, you speed, you get pulled over, you get fined. So the behavior essentially costs something literally in that instance or in that example. And you have to pay this fine, whether it be $25 or $100, and therefore hopefully you are not going to speed in the future. So your behavior of speeding is going to decrease if your response cost procedure is effective. This might happen in the clinical setting. This typically happens a lot with the token economies. So you might have a kid that comes in for the day and already has his 5 tokens. And then if he engages in a challenging behavior, he loses a token. So you can do it that way with your token economies. You can also, if they engage in appropriate behaviors, they can earn their tokens back. So you can also add it in conjunction with some type of reinforcement contingency. Things to realize about response costs is that you need to have an effective reinforcer. So if they don't really care about the thing that you're removing, then this procedure is probably not going to be effective. So if we go back to our ticket example, say you just got paid and you have all this money in your bank account and you get a ticket for $25, then that's probably not gonna, you're probably not gonna care so much. So, you have all this money in your account, here's $25. Cool, it doesn't really affect me that much at all. However, if it's towards the end of the month and you don't have a lot of money in your account, maybe you only have $20 left in your account, and now you get a ticket for $25, then that means a lot more. That's more of an effective reinforcer. So keep that in mind. They have to not want to lose that reinforcer. So whatever it is has to be really valuable for them to lose it, for them to for the procedure of losing it to decrease behavior. Immediate versus delayed, you're much more, if you remove that reinforcer immediately, it's much more effective than if you wait a little bit longer to remove the reinforcer. For instance, sometimes, going back to our ticket example, the actual remover of the reinforcer, the remover of your money, is delayed. So right when you get pulled over, you get a ticket. but you don't pay it until later. So the actual removal of that is delayed. And because a lot of times, because it's not immediate sometimes tickets don't really decrease speeding. Make sure that you don't violate rights, so you can't take away somebody's lunch or things like that. And then you always want to use this with reinforcement as well. So if the behavior costs something, okay, but if they engage in an appropriate behavior, reinforce it. Like I mentioned earlier, they can earn their tokens back, or they can get other types of reinforcers, things like that. So remember, if you're going to decrease a behavior, you always want to teach or have a replacement behavior so that the kid can get what they want, or they can get reinforcement for a more appropriate behavior. Okay, so I have a situation for you guys, and I'm going to read it, and then I want you guys to pause it and answer it on your own. So the situation is that Joey plays with various toys and crafts at a table with other preschool children. The teacher and teacher's aide play with the children, help them, and provide attention from the adults, and attention from other children. In the classroom, Joey engages in disruptive behavior, which is reinforced by the teacher's attention. She explains to Joey why this behavior is not good, hugs him, tells him to play nicely, and this happens every time Joey engages in the disruptive behavior. So basically you have Joey that plays with toys and crafts at a table with other preschool children, and he engages in disruptive behavior, and the teacher comes over and gives him attention, tells him, you know, the behavior's not good, hugs him, tells him to play nicely, and so his disruptive behavior is continuing to happen. So I want you guys to pause this and think about how you would implement timeout, response costs, and extinction. So we're starting to get into this differentiation between punishment and extinction. So after you guys have paused it and you guys come back and you think about it, let's talk about it. So if we are going to implement timeout, then when Joey engages in the disruptive behavior, his teacher will less interaction as possible, or the least amount of interaction as possible. She's not going to say anything to him. She's just going to either tell him to go to timeout, or he just engages in disruptive behavior and she picks him up and kind of urges him to timeout. Response costs is going to be, maybe Joey comes in when they start playing at the crafts. They start playing with the toys and the crafts at the table. Maybe he has a token board with 5 tokens on it, and he engages in the disruptive behavior and he loses a token. And so that would be an example of a response cost. And then of course you want to have some criteria to where if he loses so many tokens, then he doesn't get something else. He doesn't get the backup reinforcer or something that he wants to do later on. And then extinction would be, look at the reinforcing consequence, what's maintaining the behavior, that's your teacher attention. And extinction would be that the reinforcing consequence is not given. So Joey engages in disruptive behavior and nothing happens. The teacher does not come over and provide him attention, so the teacher basically ignores him. So those are the differences between timeout, response costs, and extinction. Okay, so let's briefly talk about our positive punishment procedure. So with positive punishment, remember, the learner engages in a response, something aversive is added, and therefore the future probability of the behavior decreases. One type of positive punishment procedure is what we call overcorrection. And when you think about overcorrection, what you're doing is actually in the name. So you're correcting the behavior and then you're going to overcorrect it. So one example is positive practice. So say a kid, so you're going to practice the behavior correctly and then practice it a couple more times. So say you have spelling and a kid misspells a word. They're going to practice spelling it correctly and then spell it 10 more times. Another example would be maybe throwing a balled up piece of paper at the waste paper basket. And so they would practice actually, instead of throwing the piece of paper, going and putting it in the trash can, and then they would practice that a couple more times. Another example of overcorrection is what we call restitution. So this is when there's some type of damage to the environment, and you have them restore the environment to what it looked like before the damage and then make it better. So if you have a kid that writes on a wall or writes on the desk, you're going to have them clean that wall, clean that desk, and then clean all of the walls or clean all of the desks. If you have a kid that knocks over a desk, you're going to have him put his desk in the appropriate position and then go through and make sure all the other desks are in their appropriate position. Alright, and then another type of punishment procedure is what we call aversive stimulation. So this is when you're going to, after the behavior occurs, you're going to present something aversive, and if it's effective, then the future probability will decrease. For example, in the past they've used ice cubes, sour lemon juice, shock, water spray, noise, things like that. And this is where we get those ethical considerations, or not, this is where most of the ethical considerations come into play with regards to punishment.
And I want to give you guys a little bit of context with regards to these examples of aversive stimulation. So with the ice cubes, this was conducted with a learner who would grind their upper and lower teeth together, and it made a really loud noise, and it was really damaging to their teeth. So what they did was they took an ice cube and they held it against that learner's jaw for about 6 to 8 seconds. With the sour lemon juice, this was done with a kid that was about 6 months old, and basically the kid would engage in what we call rumination. So the kid would regurgitate their food back up into their mouth. So they weren't actually digesting their food and getting the benefits, nutritional benefits from their food. So they put sour lemon juice in their mouth to stop that behavior. With regards to the shock, this was done with a kid that had really severe head banging and self-injurious behavior. And then the noise example, this was done with a kid that was pulling out their hair and engaging in lots of thumb sucking. So they basically did just an alarm buzzer when that would happen. So those are just some examples of the types of situations in which you would use this type of aversive stimulation. So the problem behavior needs to be really severe for the benefits to outweigh the risks.
Realize that when we talk about an aversive stimulus, remember, it doesn't have to be harmful or hurtful. It doesn't have to hurt the person. For example, a reprimand is an aversive stimulus. So a lot of times, a learner engages in their talking, the teacher looks at them with this icy stare and tells them no, and that to them is aversive and they stop talking. So in that instance, the behavior is talking, the icy stare and the reprimand no decreases the future probability of behavior. So that would be an aversive stimulation procedure. So keep that in mind. Those are our positive punishment procedures. And I do have a video for you guys on in your module that I think is really interesting. So I want you guys to watch this. Basically, there was a kid who had severe aggression in the classroom. So I think he was throwing desks and things like that. And what they did was they used positive punishment with aversive stimulation. So the kid also was OCD. And so basically when he would throw a desk, they would throw down, I think, cards or something on the floor that would be not in line. It would get all jumbled. And so his OCD tendencies would kick in, and that would be really aversive to him. So he would stop throwing desks and he would get down there and sort whatever it is that they threw down. So it was a way to decrease his behavior of, throwing desks around. So, all right, guys, problems with punishment. So punishment is, if you do it correctly, is very effective. With punishment, you want to be consistent. You want to, oftentimes, the first time you implement punishment, a lot of times the behavior decreases. So keep that in mind. Punishment can be really, really effective, but it is the last thing that we suggest that you guys go to. So Skinner always advocated for reinforcement procedures before you get to punishment. And that's because punishment has some really negative side effects. A lot of times you get emotional reactions from the kids. So you might get some aggression and things like that. Oftentimes you get escape and avoidance. So if you're continually reprimanding a kid, they will either don't want to be around you and want to escape you, or they'll avoid you. I don't know if you guys, when you were going through school, had a teacher that would just always get on to you. And so you walk down the hall and you see that teacher at the end of the hall and you turn around and you go a different way. So a lot of times you get that escape and avoidance. For the person that's delivering the punishment, it's oftentimes a negative reinforcement contingency, because like I just mentioned, punishment's effective. So if the child or the learner is engaging in a challenging behavior and the teacher implements an aversive stimulus, that behavior is going to decrease or stop pretty suddenly. And so for the teacher, they emit, the behavior is giving that aversive stimulus, the behavior stops, so something aversive was removed for them, and therefore they're more likely to dish out that that aversive stimulus in the future. And this is where you get a potential for abuse, because it's a slippery slope downhill. Since it's a negative reinforcement for the person delivering the contingency or delivering the punishment, a lot of times they deliver it more often, and because it is effective, and they get more intense in their delivery. So there is a huge potential for abuse. And then finally, if you are the teacher, the RBT, you are the model for your client. And if you engage in punishment procedures, your client or your learner is going to see that, and they're also going to engage in those procedures as well. So think about that. There was a famous study by Bandura, and it was his Bobo doll study. And so I don't know if you guys have heard of this or not, but in the most simplest form, it was a little bit more complicated than this, but just to simplify it for the purposes of this video, I'm going to talk about two of his conditions. So what happens is, in one condition, he had children come in and they watched a video of a lady interacting with a Bobo doll. So a Bobo doll is like this, it's a couple of feet high, it's this kind of blow up doll. And so the lady in that condition was really nice to the Bobo doll. She played with them, things like that. And then the kid got a chance to go in and interact with the Bobo doll. In the second condition, or the other condition I'm going to describe, the kids came in, they watched a video of the lady interacting with the Bobo doll, but this time the lady was really mean to the Bobo doll. She verbally abused him, she hit him, she kicked him, things like that. And then the kids got to go in and interact with the Bobo doll. And what happened is they were looking at the kids' interaction with the Bobo doll after watching the lady interact with the Bobo doll. And they found that in the condition where the kids watched the lady be really nice to the Bobo doll, they were really nice to the Bobo doll. And in the condition where they watched the lady be really mean to the Bobo doll, those kids were really mean to the Bobo doll. So kids will imitate their models. So you modeling punishment procedures, kids are going to imitate that, and they're going to engage in punishment procedures to other people, which you don't want to happen. Okay, so last thing with regards to punishment, I really want to make the distinction between punishment versus extinction, because both of these procedures will decrease behavior, but they're procedurally different. So let me give you guys an example. We got 7-year-old Sue, and she's picked up some new words from older kids in the neighborhood, such as the S word and the F word. Each time Mom hears Sue use those words at home, she gets really upset. In addition to reminding Sue of her middle name, she sits her down and explains to her that she's not going to tolerate hearing these words in the house, and if other people hear her using these words, they'll think she comes from a bad home. Unfortunately, Mom's attention functions as a reinforcer for Sue's behavior of using those bad words, and therefore the behavior is increasing in frequency. So my question for you guys, I hope that you pause this video again, and I want you guys to tell me, how would you use positive punishment, how would you use negative punishment, and how would you use extinction? So let's look at this contingency. Before, Sue has no attention. She uses those obscene words, and her mom gives her attention. So if we talk about extinction, remember with extinction, you are no longer providing this reinforcing consequence. So with extinction, she has no attention, she engages in those cuss words, and her mom ignores her, does not provide her with that attention. So this reinforcing consequence is not being given. What about positive punishment? With positive punishment, remember, she engages in the response and something aversive gets added. So Sue has no attention, she cusses, and now she gets extra chores, and that results in the future probability of the behavior decreasing. So now let's look at negative punishment. With negative punishment, maybe she has access to TV in her room, she cusses, and now the TV is taken away. So hopefully this kind of lays it out for you guys. You need to figure out what your three-term contingency is, what your ABCs of the behavior are, and with this one, she cusses and she gets attention, so it's attention maintained. So with extinction, you're not going to provide that consequence. With positive punishment, you're going to add an aversive stimulus, and with negative punishment, you're going to remove something that was pleasant to her that she already had. So all three of these decrease the future probability of the behavior. They're just procedurally different. So let's see if you guys can identify some contingencies. Oh, sorry, before we do that, I have a little flow chart for you guys that when you're looking at situations, you can figure out what contingencies they are. So first of all, you want to know, does the behavior increase or decrease? If it increases in the future, it's reinforcement. If it decreases, it's punishment or extinction. If it's reinforcement, is the consequence, are you presenting something pleasant or are you removing something aversive? If you're presenting something that's pleasant, it's positive reinforcement. If you're removing something that's aversive, negative reinforcement. With punishment extinction, is the consequence, are you presenting an aversive stimulus? If so, it's positive punishment. Are you removing a pleasant stimulus? If so, it's negative punishment. Or is nothing happening? So the kid engages in the behavior and that reinforcing consequence is not given. Nothing gets added, nothing gets removed, just that reinforcing consequence is not given anymore. And the reinforcing consequence gets removed, but nothing besides that gets removed. And so that would be extinction. So hopefully you guys can take this little flowchart and go through it when you're presented with situations and figure out what contingency is it? Is it a reinforcement contingency, a positive punishment contingency, or is it extinction? So let's try some of these. Okay, every time Matt swears in the house, his little brother Nathan cracks up. As a result, Matt's frequency of swearing in the house increases. So Matt swears, his brother laughs, and as a result, his frequency of swearing increases. So since the future probability is increasing, we know it's reinforcement. So now we got to figure out, is it positive or negative? And after the behavior occurs, something pleasant gets added. So his brother is cracking up, is laughing. So this would be positive reinforcement. Okay, eventually Matt's brother gets tired of Matt swearing and stops laughing at him. As a result, the frequency of Matt swearing in the house decreases. Okay, so remember, we had a positive reinforcement contingency. Matt swears and his brother laughs. But now his brother is not laughing at him anymore. So that reinforcing consequence has been removed. And therefore, his behavior is decreasing. So since his behavior is decreasing, we know it's either punishment or extinction. And there's nothing aversive that gets added. There's nothing in addition to the reinforcing consequence that's getting removed. And so this would be extinction. So, Matt swears, his brother laughs at him. That's the reinforcing consequence. The reinforcing consequence isn't being provided anymore, and therefore his behavior is decreasing. So it's extinction. All right, every time Matt swears in the house, his mother makes him take $1 out of his allowance and put it in the swear jar. As a result, Matt's frequency of swearing decreases. So we have swearing again, it's decreasing. So we know it's either positive punishment, negative punishment, or extinction. So this time he has money and he engages in the behavior and his mom makes him remove some of his money. And so since something pleasant gets removed, this would be negative punishment. Alright, at parties, Kevin used to make jokes about his wife's cooking and got lots of laughs from his friends. At first his wife smiled, but eventually she got upset. Whenever Kevin makes a joke about her cooking, she gave him an icy stare. As a result, Kevin stopped making jokes about his wife's cooking. So, Kevin makes a joke, his wife provides an icy stare, and Kevin's behavior of telling jokes decreases. So, since his behavior is decreasing, we know it's either positive punishment, negative punishment, or extinction. If his wife just ignored him, then if she just stopped smiling and just ignored him, then that would be extinction. But she actually gives him an icy stare, and that icy stare is an aversive stimulus because the behavior is decreasing. So this icy stare gets added. So this would be an example of positive punishment. And this might happen to you as well. I don't know, you're out at parties with your partner and you do something and they glare at you or they stare at you and you think, oh God, I shouldn't have done that, and you don't do that anymore. So that's positive punishment. Alright, when Alma was in the daycare program, she sometimes hit other kids if they played with her toys. Alma's teacher made her quit playing and sit in a chair in another room for 2 minutes each time she hit someone. As a result, Alma stopped hitting the other children. So her behavior is decreasing, so we know it's positive punishment, negative punishment, extinction. And after she hits, she gets removed from her environment that she wants to be in, and therefore her behavior decreases. So this would be that negative punishment. And this would be an example of our timeout procedure. And this would be exclusionary timeout because she sits in another room. Alright guys, so that's your little training on punishment. So now we're going to get into crisis management, just briefly. With crisis management, this is what we talk about when we have a behavioral emergency. And remember, we talked about that these are typically not written into the plan because these are not everyday procedures that should happen. So these are emergencies to which the behavior has gotten so out of control that it's causing harm, that might cause harm to you or the other kids, or to the learner him or herself. And so these are for those emergencies where the behavior has escalated to where it's just really dangerous. So these crisis management, these procedures are only used for maintaining behavior in the moment. These are reactive procedures that not used to, eventually decrease the problem behavior. These aren't your typical differential reinforcement strategies and things like that. These are emergencies to deal with the behavior in the moment, to reduce that behavior as quickly as possible so that nobody gets hurt. So this might be something like restraint for the kids, protective equipment, or moving rooms. So your clinic might have a padded room to where if the behavior escalates, the kid might be put in a restraint and moved to the padded room. Now realize that depending upon, different clinics have different ways of dealing with behavioral emergencies or crisis situations. So you might be at a clinic that is managed by a company where they don't believe in restraints at all. That is never okay. You might have a clinic that is okay with restraints if the behavior is really severe and if everybody has looked at it, the costs outweigh the benefits. It's only for that moment to where the behavior is harming, might possibly harm other kids or harm the learner. So it just depends on your clinic, the rules, and things like that. I want to tell you guys to, if you are working with a kid, that there's an emergency plan for the kid. So his behavior could escalate to where it's harmful. I want you guys to think about being proactive. A lot of times what happens is we will see the kid will engage in what we call precursor behaviors. So these are behaviors that give you a clue to know that, hey, this behavior could escalate really quickly. For example, sometimes if a kid has really severe problem behavior where they're going to pick up and throw desks or throw the pencils or throw the markers at other kids, sometimes before it gets to that level, they might start rocking back and forth in their chair, or they might start kind of hitting the desk over and over again. And so you'll start to learn this is a precursor behavior. He's starting to get agitated, him or her, starting to get agitated, and if nothing happens, this behavior is going to escalate. And so those behaviors that occur before the actual behavior occurs are what we call precursor behaviors. And you can actually design interventions to help decrease precursor behaviors. And a lot of times when you intervene with a precursor behavior, the behavior doesn't get to those really severe levels that escalate. So you start to see those precursor behaviors, you ask for help. You want to target and decrease that behavior now. Know the plan. So this might be, you might have to do training. You need to practice the plan. All those things come into play. You need to know what's going to happen. What happens? How are you supposed to react to the learner that's engaging the challenging behavior? What are the other kids supposed to do in the classroom? Remember, it's all about de-escalating the behavior at the moment and keeping everybody safe. What happens to the rest of the people in the clinic? I know I worked at a clinic where there was a kid, he was a big kid and he had severe aggression, and so when his behavior would escalate, where they would have to do these this crisis management plan, everybody in the clinic, we would have to just kind of, whoever we were working with, we would get up and just shut the door because it was really loud and it was really disruptive. So you need to know if you're in the same room as that kid, if you've been working in the same clinic, what's the plan? If you start hearing things escalate in the next room, what do you do to protect your learner? You may not be directly involved with the situation, but do you need to take the learner to a specific room in the clinic? Do you need to just shut your door? What's the plan for the clinic? And like I said, practice it, because these behavioral emergencies or these crisis situations hopefully don't happen all the time. And so when they do happen, you need to be fast and you need to be effective, because you need to control the behavior as quickly as possible so nobody gets hurt. So making sure that you practice it with the people in your clinic and things like that, so that it starts to escalate and it gets to those levels and you know exactly what to do. Also, keep your cool. So the kid might be yelling at you, saying horrible things, and you've got to keep your cool and you've got to manage the situation. If you get agitated and you can't deal with the situation, then it's bad. So keep your cool. Realize they probably don't mean anything that they say to you. Just focus on managing the situation, keeping everybody safe. And you might need some training. So hopefully your BCBA, they should know when you're working with a kid who has a crisis management plan or a plan for a behavioral emergency. And if you are working with that kid, you need to make sure that you're trained. So go to crisis management training. If they want you to do restraints, make sure that you've been trained in those. You know how to do them appropriately. There's a way to restrain kids so where they're not going to get hurt, and you want to make sure that you know those ways. You don't want to hurt the kid, even if they're trying to hit you and trying to hurt you. You don't want to hurt them. So being trained in the procedures and the methods that they want you to use is really important. If you don't feel comfortable doing it, ask for training. That's one thing that you need to talk to your supervisor or your BCBA about. All right, so safety plan steps. Identify your behaviors that signal safety strategies. So once you see that a behavior is starting to escalate, and it could escalate, have a signal that lets everybody know, hey, we're about to go into this crisis management plan. Let's all get ready. Let's be prepared. Make sure that the plan is laid out. So you want to describe each action that must be taken to keep everyone safe. You want everybody to know what's going on. You want everything laid out, so that way, right when it happens, you can take care of it and you can decrease the situation and de-escalate the situation as quickly as possible. Identify the personnel that will assist in implementing the plan. So, identify who's going to be doing those crisis management plans. If it's the clinic director, whoever it is, the BCBA, you want to make sure that you have an intercom system or you have a walkie-talkie that when it's starting to escalate, you can call them. They can be on standby and they can come in and swoop up and they can take care and de-escalate the situation. So know who's engaging with the learner, know what everybody else is doing, plan. Identify what the other children will do, which we already talked about, and then have personnel and materials readily available. So anything that you need to deal with these crisis behaviors, know the plan, have them available. When you start to see this behavior starting to escalate, get ready, make sure everything is prepared, because right when it starts to happen, you want it to be de-escalated as quickly as possible. Okay, last thing I wanted to go over is the phases of acting out. So there are typically kind of 7 main phases of when a kid will act out. The first phase is that the student is calm. So they seem content, they don't show any signs of tension, stress, anger. They may be working or socializing, everything's pretty normal. And then the second step, something is going to trigger the student. So the student is going to exhibit heightened awareness, sensitivity. They may start to appear distracted, things like that. So the student might, stop engaging with work or with peers. They might say, hey, or quit. You might hear those words come out, or they might kind of slump their shoulders, or something's going to happen where it's going to kind of trigger them. The third stage is agitation. So in this stage, you can actually see behaviors that indicate anxiety or frustration. So they might have busy hands, darting eyes. They might start to withdraw from the group. Their change might focus quickly. They might start using really terse responses with their peers or with you. Maybe excess movement or excess activity. That's typically what you're going to see. And then you're going to have an acceleration phase. So in the acceleration phase, this is when the behavior becomes focused and directed towards engaging others in a negative interaction. So they might start to question or argue with peers or you, the RBT. They might refuse to cooperate. They might use an inappropriate voice level, things like that. And then you get to the peak of it. The crisis or the peak is the phase that includes those really serious behaviors that can pose a safety threat to the student or to you or to anybody in the room. And this is when you get those behaviors of, destruction of property, tantrums, pushing others, and things like that. And then hopefully your crisis management plan goes into effect, and the next step is that de-escalation. So this is when the student begins to calm down, the behavior decreases in intensity, and things like that. And during the de-escalation phase, you might see the kid kind of withdraw. He might blame others, deny what he's doing, avoidance of discussion. He might not want to talk to you. He might be kind of unresponsive to activities or direction. He's just going to kind of withdraw from the situation. And then you have the recovery phase, which marks the student's return to the calm phase. So now they might start to want to work independently or start to engage in activity. They might be a little cautious or quiet, but they'll start to kind of join into the group work and or the independent work, whatever it is that you're having them do. So don't forget about those precursor behaviors. So when this behavior is escalating, there's typically some type of precursor behavior in here that's going to signify, hey, if something doesn't happen, if my environment doesn't change, I'm going to get to this really challenging problem behavior. And like I said, if you notice precursor behaviors, know what to do. Hopefully there's a plan for the precursor behaviors that you're aware of, you know how to do, and start doing your signals, start warning people like, hey, he's engaging in these precursor behaviors. I'm going to implement this intervention, but if it doesn't work, it might get bad, and we all need to be on board and be ready. And then make sure that you guys practice. So just reading this crisis management plan in a notebook and kind of imagining what you're going to do isn't sufficient, because when this happens, when they get to this stage 5, when they get to the crisis or the peak stage, it's loud and it's disruptive. And when I was in the clinic that was happening at, our whole clinic knew what was happening. It is loud, it's disruptive, it's crazy. So practice the procedures, know exactly what you're supposed to do, know exactly what other people are supposed to do. Be ready, because you want this de-escalated as quickly as possible. And the more you're running around not knowing what to do, is more time that somebody could get hurt So keep that in mind. Alright guys, so for this video we talked about punishment, kind of the definition of it. We just reviewed it. We talked about negative punishment procedures, so our timeout and response costs. We talked about positive punishment procedures, so overcorrection and aversive stimulation. We talked about problems with punishment. Remember, punishment should be your last resort. So try those reinforcement-based strategies to decrease behavior. Try all those. Try your antecedent manipulations, everything like that before you go to a punishment procedure. We talked about punishment and extinction. Remember, both of those procedures decrease behavior, but there are procedural differences between the two. And then we wrapped it up with crisis management. So please let me know if you guys have any questions as you're going through and you're looking at punishment and crisis management. And thanks for listening. All right, thanks guys.